High Functioning Autism, a case study. You can go to the website, click right here under IFN case studies. So I'll just read this one. At the age of 20 months, this patient had difficulty speaking. He got obsessive behaviors, regular mood swings, and poor social behavior. He was born 10 days overdue with multiple instrument-assisted birth. Until the age of 20 months, he developed normally and met all milestones as expected. He was also given the full spectrum of standard immunizations until the age of 18 months, including MMR and chickenpox. At the age of 18 months, he lost eye contact. He began rocking back and forth, developing obsessive behaviors and regular mood swings and tantrums, and did not develop his speech. These symptoms did not progress and were constant. Upon presentation, this patient only method of communication was sound. He constantly ran to the nearest door and repeated open and closed, sometimes locking himself in. He had no interaction with other people in the room, including eye contact. No acknowledgement that he had been spoken to, no comprehension of what was said to him, and no emotional interaction. He constantly ran aimlessly up and down the corridor and was unable to be toilet trained despite multiple attempts. Physical exam. Physical examination demonstrated dysmetria in the left finger to nose test. Dysmetric, I can't say all these words. Deep tendon flexibles in the so they're noticing stuff. Initial findings on the QEEG, there was a significant decrease in function in the frontal cortex as well as the midline frontal cortex bilaterally. This seemed to be more prominent, in the left frontal region. You can see the scans right there. Therefore, this became the focus of treatment initially. His coherence was also dysfunctional, mainly in the left frontal and parietal regions. Low-resolution electromagnetic tomography Loretta analysis showed that the most significant dysfunction was in Brodmann Area 21, which is in the left language area of the brain. It is involved in selective processing of text to speech, semantic processing, sentence generation, word generation, visual observation of motion, auditory processing of complex sounds, attribution of intention, and see all the areas. Like they see how he's behaving, that he can't do this and that. And then they see, in the brain, there's some issues here. We need to tweak it. We need to change it. And as those things normalize, the symptoms then go away too, usually, like they did with me. But every brain is different. You just got to try it, tweak it, and then see what happens with symptoms. There's no guarantee, but you just have to do your best to tweak it to get it back to normal, and then wait a few weeks to see if the symptoms then start normal or going away. The follow-up, listen to this, okay? The follow-up QEEG examination demonstrated a normalization of the hypoactivity in the frontal lobes of the delta, theta, alpha, and beta frequencies. Amazing. There's the residual central frontals, I can't say that, which I don't know how to say that, which continue to be treated to achieve normalization. Loretta analysis showed that the areas of dysfunction, Brodmann Area 21, was completely normalized. You hear that? And no dysfunction was present. They could see in the brain waves that now that area is normalized. It wasn't too fast, too slow, whatever it was. It's normalized. So check this out. After a few months of therapy, the QEEG had improved significantly in the appearance, showing normalization of the hypoactivity areas in some frequency ranges. Loretta analysis demonstrated complete resolution of the primary dysfunction matters. Amazing. Symptomatically, the patient's parents reported increase in function in every aspect of their child's life. He's now fully toilet trained and interacts verbally and emotionally with those around him in an appropriate manner. He uses a full range of vocabulary and is interested in his surroundings. Comprehension of all conversation is age appropriate, and he responds adequately in a timely manner. So his obsessive behaviors are reduced to age appropriate airplane fascination. There's no signs of running around or repeated door closing, opening. He's well behaved, can interact better at school, and it's a pleasure to be around. To the new acquaintance, he does not show autistic traits or behavioral dysfunction. Can you believe that? You heard what I read earlier, right? And now, if you were to meet the kid now, you wouldn't even know he had any issues. He had issues before. He behaved like that. I'm telling you, got to get the message out. Too many kids with ADHD, they're being labeled as problem children, all that stuff. Rewire their brain, normalize those areas of the brain that are in effect negatively, and then see what happens to symptoms. I mean, it's just like, we need to get the word out, man. It's just look, you can see me, this is what I look like. I was a mess for years. Y'all said I was crazy. Spent $250,000 going all over the world to the best, we literally went to the best clinics. Then we finally found Dr. Beck, who is the best, and life-changing. So check out this video. You can check out the video here, or you already saw part of that, but I share more of my story there. If you have any questions, let me know. Check out you gotta check out the case study. It's a miracle, and these things happen all the time. Like they just changed the brain pattern, normalized the brain patterns, and these symptoms just, disappeared then. It's amazing. It's really a miracle. And you can be treated at home. If it wasn't for that, I'm telling you, it's so discouraging to tell people, okay, yeah, there's this amazing treatment, but it's in Australia. You got to go there for 6 months or a year or 2 years. Nobody can afford that. That's why I was like, hey, sign me up, man. I'm going to tell everybody about it. So I do get referral commission if you use promo code Bjorn, and you'll be supporting my mission to reach as many people who are in the same situation as me. All right, guys. I'm trying to think if there's anything else I was going to mention. That's about it. Check out the case study. Tell me, man, Dr. Beck, it's incredible. He's really discovered something that's going to look back on years from now and it'll be like, this is the greatest treatment there ever was. And they'll make it even better. It gets better every year. But QEEG, this is what it looks like. They can see the different colors of what's going on in the brain. And Dr. Beck, again, he's the best. He's the one that everyone goes to when they have cases that they don't know what to do with. So check it out. If you have any questions, let me know. And thank you so much for leaving. This is all from bjornbrain.com. You can check it out. And you can see the videos and go to Dr. Beck's YouTube channel right here. I have links to everything there. So cool. Thank you so much for listening. Let me know if you have any questions. All right. Bye-bye. Okay, so this is a story of JK at age 16. She had a traumatic brain injury while on holiday with her parents. You can see she had a car crash. JK was told there's nothing that could be done to her. Okay, a story of so many, including me. So you see the eyes are going all over the place. She's not able to focus. It's very difficult for her to do that. So after 6 weeks of intensive treatment plan at IFN, JK resumed normal life attending university with her peers. Check this out. Look at that smile. See? Isn't that incredible? After 6 weeks of treatment, this is the result. And the doctor was telling her there's nothing that can be done. All right, it's just incredible. Okay, this is a story of Madison at age 4. Madison was treated for IFN for severe epilepsy, could have up to 100 seizures per day. Very, very serious. Madison's first QEEG was at IFN. You see, you got the cap on with the sensors. Within a week, her seizure rate dropped by 90%. If that's not life-changing, I don't know what it is. 90%. For her and her family, totally life-changing. Look at that smile. Okay, next one this is the story of RH at age 12. RH had a bicycle accident resulting in a mild concussion. In the following days, he deteriorated, developing significant leg pain and ultimately unable to walk without assistance. Repeatedly, his parents were told he was simply attention-seeking. He can't walk. And this is the story of so many of us. The doctors just say, oh, I just want attention, or just, it's a thing, it's so sad, okay? We just need to get the word out. People need to know about this. So that's what the parents were told. Then they went to, after 6 months care of IFN, look, see, the guy's walking. He needed the brain to be rewired, Like it was possible for him. He wasn't seeking attention. This is 9 months of care with IFN. See that walking. It's amazing. RH is now back to living a normal teenage life. Just incredible. Okay, this is the story of Sam at age 18. Sam suffered a severe neck injury while at the beach, which left him quadriplegic. Very, very serious. He was told he had less than 1% chance of regaining any movement. After intensive 6-week treatment, see, he's moving his left leg because there was a connection in his neck. So they probably ran tDCS up and down the spine to restore that connection, and then they work on the brain. But they see there's movement in his left foot. After 12 months of treatment with IFN, see, he's walking aided. See, now he's walking just with Dr. Beck next to him. And then he's dancing his way to recovery. That's a miracle. Look at that. You see what he's doing? 1% chance of having any movement. Finally, against all odds, Sam walks unaided. I mean, look at that. Whole families can be transformed forever, okay? This is Ben. Let me go back real quick. So this is Sam. He walks unaided. Incredible. This is the story of Ben at age 12. He was a problem child, turned award winner. Teachers didn't know what to do with him. He was diagnosed with 3-year history of ADHD and dyslexia. See his eyes? So he began failing at several schools, unable to achieve the required milestones. IFN identified he suffered with sensory confusion involving movement of his eyes. It was not ADHD. But that's what the label they gave him. That was his challenge, not ADHD. So there was something that had to be rewired in the brain. So after 12 weeks of treatment, let's see what it says here. After 12 treatments with IFN, Ben is now winning awards at school. Amazing. He can read and no longer suffer with anxiety. He's back to living a normal life. I mean, if that isn't incredible, I don't know what is. And it's the same story that I had. People said all these different things. It was